Have you been feeling very tired, have trouble losing weight, dry skin or hair loss? It could be more than just stress or poor diet. These are some signs that your body may be giving you that your thyroid is not functioning as it should. In today's video, we'll talk about hypothyroidism, what it is, what the most common symptoms are, who is most likely to develop it, how it is diagnosed, and what treatment is recommended. Stay with me until the end because this information could transform your health or that of someone close to you. What is hypothyroidism? The thyroid is a small butterfly-shaped gland located in the front of the neck. It is responsible for producing hormones that are essential for the functioning of practically the entire body. When it does not produce these hormones in sufficient quantities, we have hypothyroidism. This affects the metabolism, that is, the rate at which the body performs its functions, and can cause a series of uncomfortable symptoms. Hypothyroidism versus hyperthyroidism. It is important not to confuse hypothyroidism with hyperthyroidism. While hypo means insufficient hormone production, hyper indicates the opposite, when the gland is working too hard. In hyperthyroidism, the metabolism speeds up, and the person may experience symptoms such as rapid weight loss, anxiety, and insomnia. In hypothyroidism, everything slows down. Who is most affected? Hypothyroidism can affect anyone, but it is more common in women, especially between the ages of 35 and 60. After menopause, the risk increases even more. People with a family history of the disease or with other autoimmune diseases are also more prone. So, what are the warning signs of hypothyroidism? Here are the main symptoms you might notice: constant fatigue, feeling cold even in hot environments, hair loss, dry skin, constipation, weight gain for no apparent reason, depression or discouragement, irregular or heavier menstruation, difficulty concentrating and remembering, weak nails, and swelling of the face or eyelids. These symptoms often appear gradually, and we might think, oh, it's just part of the routine or maybe just part of getting older. But really, it's the body asking for help. So, how do you know for sure? Who should you see and what tests should you do? If you identify with these symptoms, it's important to see an endocrinologist. They're the specialists in hormones and metabolism. The diagnosis is made through blood tests that check the levels of TSH, or thyroid-stimulating hormone, along with T3 and T4. When TSH levels are high and the T3 and T4 hormones are low, it's a clear sign that the thyroid is sluggish. Now let's talk about treatment. The good news is that treatment for hypothyroidism is simple and effective. It involves replacing the thyroid hormone with a medication called levothyroxine. This is a medication that's taken daily, usually for life. When the right dose is prescribed, the symptoms disappear and quality of life improves significantly. But here's the thing. Regular medical monitoring is absolutely essential to adjust the dose according to your body's needs. What happens if hypothyroidism is left untreated? Well, ignoring it can lead to some serious consequences, such as heart problems, increased cholesterol, infertility, severe depression, and even myxedema coma, which, although rare, is a very serious condition. Now that you know how much the thyroid influences your health, it's so important to pay attention to your body's signals. If you suspect anything, don't wait. See a doctor and get tested. If you found this content helpful, please leave a like, share it with someone who might need this information, and subscribe to the channel for more videos on health and well-being. Take care, and see you next time.